So much for being here. My name is Nikki Clark, and I'm the Vice President of Community Wellbeing at Heartland Family Service. We're really excited to start this unique collaborative with so many partners. And so I just wanted to get us started and introduce Shay Orduña, who's the Program Director of our Community Center here with Heartland Family Service.
Good morning.
Good morning.
I'm so excited to see everyone here at this press conference. As we announce, for North Omaha has the honor of being one of 18 Build Health Challenge sites for 2019. The Build Health Challenge works with communities to tackle root causes of disease. Its focus is on prevention, not pills and prescriptions as a pathway to better health. About 70% of our health is attributable to the environment around us, where we live, where we work, where we play. All of the Health Build Challenge communities are working to address the root causes of health issues that have the most profound impact in their local community. We were selected. Yes, we were. We were selected for this prestigious award because of our commitment to collaboration, strong resident leaders, and an innovative plan to tackle social determinants and health impacting mental health disparities. What sets our project apart is that we have 4 major health systems here. When we add in Douglas County Health Department, Live Well Omaha, Charles Drew Health Center, UNMC College of Public Health, and Holy Name Housing Corporation, we have one incredible, unique, strong collaboration. Participation in the Build Health Challenge means that we'll be bringing more resources, more funding to Omaha to shine a spotlight on our project and our unique collaboration and resident engagement. I'd like to introduce to you Karen Davis. She is a member of our North Omaha Community Care Council. Karen.
Good morning. Through the work, we will shift who controls the resources and the decisions in the neighborhood about the factors that contribute to the health and the organization and the systems to the residents themselves. We are very, very, very excited about the programs and the opportunities that are going to be brought to the area of 68111. And I want to thank you all for participating very much. Thank you.
I would like to introduce Jeff Prohaskas, Vice President, Strategic Planning and Business Development for Methodist Health Systems.
Good morning, thank you. I think that's probably the first time that my last name was said correctly. I've never introduced, so appreciate the enunciation of Prohaska. Methodist Health System, we're really proud to be part of a community that cares for our people. Methodist has been caring for its people for almost 130 years. Caring and giving back to the community, it's important. It's part of our mission at Methodist Health System, which is improving the health of our communities by the way we care, educate, and innovate. We're proud to be part of this Build partnership. It's an opportunity for us all to come together in a unified way to make an impact. Most importantly, it's a way for us to listen to our friends and our neighbors. Omaha's a wonderful community. When we work together, great things will happen. The Build Partnership is an important initiative. In Methodist Health System, we congratulate Heartland Family Services for their efforts to find the dollars and grant funding. Now I'd like to introduce Dr. Deb Tomek from Children's Hospital and Medical Center.
Good morning, everybody. On behalf of Children's Hospital Medical Center, I want to congratulate Heartland Family Services for their successful Build Health Challenge Award. We
are really happy to be a participant as well. Children's mission is to improve the life of every child, not just the children that come to our door for healthcare, but our whole community's children. And to accomplish this mission, we have to foster cross-sector partnership that lifts up the voice of residents to drive solutions for their communities. The model that's being used for this particular activity is just innovative and just hits at the heart of what really is needed to happen. No top-down decisions, but really rather bubbling up the solutions and the issues, the challenges that are present in our community to get real solution focused. The Children's is thrilled to support this work with the other 3 health systems. We do, in community benefit, we collaborate, okay? There may be competition in other parts of our systems, but community benefit is one of those areas where we need to bond together because we cannot do it alone. We want to listen and learn from the community so that we can really do the efforts, and the residents of 68111 deserve that, okay? They've long deserved it, and I'm glad that we can now do this. According to our 2018 Pediatric Child Health Needs Assessment, we know that there are gaps, but we haven't filled in yet the solutions, and we don't know what those are, and we haven't been able to figure those out even for the 12 years that we've been doing community health needs assessments, and so we need to go in a different direction. There are many opportunities to enhance protective factors for families that really mitigate the effects of stress that's prevalent in our community. So taking this place-based, intergenerational approach that delivers some strategies that I hope will work really for the community benefit for decades moving forward. We need to bond not only the children that we serve at Children's, but we need their families and their grandparents and those yet to be born to really have a healthy place to live. Really, again, congratulations. Our children's team is here to help however we can. We don't want to be just funding partners, okay? So you heard me say that, so hold me to it. Really want to add boots on the ground and the resources that we can to really make this a successful adventure. It's now my privilege to introduce Pete Festerson, Vice President of Strategy and Public Affairs with CHI Health.
Well, on behalf of CHI Health, I just want to say how excited we are to be here today as well. I think this is one of the most important things we can be doing to improve the health of our communities. And I agree with everyone that has spoken so far, and I'm sure they will follow me in that to really have an impact on these issues, we need to be working together. And so that's, to me, one of the most exciting things about the announcement today is to have all of our health systems working together on this issue of behavioral health, and any issue going forward, I think is so important to really move that bar. And I will say I'm very encouraged in our community in the respect that I think city, state, and county leaders, nonprofit leaders, providers for sure, corrections officials, police chiefs, everyone is understanding the importance of behavioral health and how that impacts literally everything else we do. When 1 in 7 families are impacted by behavioral health in some respects in this state, that's, I think, an indication of how important this is and how important it is for us to partner to work on this issue for our communities. CHI is one of the largest providers of behavioral health in the state of Nebraska, but we know we also can't do it alone. So bringing our resources to bear along with everyone else here today is one of the most exciting things I think about this announcement, and definitely appreciate the partnership with Heartland Family Services too. I've been here a lot recently, actually. I was telling John, I have daughter number 2 going through their service program right now, so I'm pretty familiar with the building at this point, but they do great work and are a great partner in the community. We appreciate their initiative on this too. Thanks.
Good morning. My name is Howard Liu. I'm the chair of psychiatry at UNMC and also a practicing child psychiatrist. And I'm really delighted to represent Nebraska Medicine and UNMC today for this really exciting project that Heartland Family and so many others have built together. I would say that both as a clinician and as a mental health leader, that any impact has to be long-term. And so as a health system, we're deeply committed to working with North Omaha in the long term and really being there through this project and many others to try to pull things together across all these health systems. So we work closely with Charles Drew Health Center, with Douglas County and many others, both on justice-involved youth, also with adult mental health, and also individuals in crisis, really looking at how do we make sure that people are healthy and able to return to their communities in their best state of mind. As a former state workforce director, I also know that it takes a long time to solve health disparities. So when there's a gap, it can take about 6 to up to 14 years to train a single licensed mental health provider after high school. So when you talk about being here for the long term, we're talking about not just a few months, but years and even decades to really make sure we solve some of those gaps. So as an adult and a child psychiatrist, I also think we have to work upstream. Every day I have conversations with clinicians who really say, well, you know, the real work is in the neighborhoods. It's really not here in the emergency room. It's not here in clinic. It's really looking upstream and really thinking about schools, thinking about the community, thinking about organizations like Heartland. They're doing truly amazing work. So to really get to the right answer, we can't bring the solutions. They have to come from the community. And so we're deeply committed to listening to the residents and to really being collaborative in this process to come up with a solution together, because that's really the only way things are going to be sustainable in the long term. So I know this is one of the first times we collaborate across the 4 health systems in a project like this in mental health, but I would say many of us have been at the table on many projects, and we are deeply committed to partnering together to make sure it's a success. So without further ado, let me introduce one of my great colleagues, the CEO of Charles Drew Health Center, Mr. Kenny McMorris, to share his role in this project.
This is a very exciting day, I would say, for the state, for the city, but more importantly, North Omaha. I've had the pleasure of serving as the leader for Charles Drew Health Center for the last 5 years. And what we know in the work that we do at Charles Drew, it really is about community. We understand the importance of residents. We understand the importance of people taking ownership of their health care. And so every day we work to make sure that those services are provided. We have very dedicated staff. We have a consumer board that everything that we do is led with the community in mind. And so today is a great opportunity to serve as a catalyst to move these things forward. As what has already been presented, we've worked over the years to really look at how do we improve the quality of life for all Omahans, but more importantly, individuals residing in North Omaha. And the data is very clear. We know that there are a number of health disparities and a number of things that are driving the health-seeking behavior of the population, in which we have to do a better job of providing opportunities for individuals to take ownership of their health care. We know that when you can provide the services in a comfortable, friendly environment where relationships can be built and trust can be built, people will be healthy. And so today is a great step forward in terms of moving the needle as it relates to North Omaha. We've been here for 38 years. We've had the pleasure of working with Heartland Family Services. We actually have a health center literally right on this campus that provides primary medical and behavioral health services. And so today is going to be a great opportunity for us to reaffirm our partnership, to reaffirm commitment to community. But at the end of the day, it really is about the people. And so when you have a city, when you have a state with so much abundance, we got to make sure that we're taking care of the least of us. And so today reaffirms that commitment. We're in a position, this is great for the state of Nebraska, great for Omaha, and great for healthcare and individuals residing in 68111. And so with that being the case, I have the pleasure of bringing up Ms. Nikki Clark. She is Vice President of Community Wellbeing for Heartland Family Services.
Thank you everybody so much for being here and saying all those amazing things. So I just wanted to open it up to questions. Had questions? Questions? So what will this money specifically be used for? So this money is, so actually we have a 50% cash match from the health systems, and then 50% comes from the Build Health Challenge. And so that will come from, or that will be used really to funnel towards what the residents decide to use that for. And so we will have meetings with with the residents that live in this neighborhood. We have already gone door to door. We've been in this community for several years, and so we know the residents, and we will be able to bring them together to say, hey, what are the things that you want to address in your community? And it really will drive everything that we do.
Is this solely based in behavioral and mental health care, or is this looking at other social determinants like environmental health, being a history of a lead Superfund site, toxic pollution, those things like that?
That's a great question. So the reality is that there are so many things that lead to mental health. So when we talk about, lead, that leads to people's mental well-being down the line. And so there are so many things that are actually connected to mental health that oftentimes we don't think about. And so what this project does is say, we're going to affect mental health in the long term by addressing those social determinants of mental health. And so it's less about, let's get everybody going to therapy, right? But more about, what is it that you want to address in your community that's going to affect your mental well-being and you being less stressed. And so it's less of like a clinical, when we think of clinical therapy, and it's more of those social determinants.
So you'll start by meeting with residents. What is there a structure or framework? Or
Yes.
how will that work?
We'll just make notes. I better not say it out loud. So we actually will, we are using what we call the SelfHealing communities model. And it is a model that expands leadership among residents and then kind of helps them to focus on the actions that will address what they want to address. So for example, if people say, well, we have an issue with food insecurity, right? Like I feel like I can't, I don't have enough healthy food, or healthy food is too expensive. Well, okay, so what can we do about that in partnership with the residents to be able to address that? Because that leads to stress, right? Which leads to someone's mental well-being and their mental health. And so with this model, what we would do is expand leadership within this neighborhood. So our first step is actually hiring somebody who lives in this neighborhood to lead this, this collaborative, because that's what's really important. So expanding that leadership, not just for that one person, but for people all over the neighborhood. And then how can we give them the skills to make these changes within their community? And that would be with our help, right? So it's really marrying the resources of everybody here, which we have a lot of resources, with the residents' knowledge, because they have the knowledge of their own neighborhood. So it's less of us coming in and saying, we have this service for you, and more of, we have these resources for you. What do you want to do? So we do have a model that we're using. It's called the SelfHealing Communities model. And that was actually provided to us by Children's Hospital. They're familiar with the model, so. Any others? Yes.
So out of all the places in the country, it's significant that Omaha was chosen for this. So talk to us about the significance and why Omaha was chosen.
Absolutely. So Omaha was chosen because of our unique collaborative. That was something that was told to us, that they were surprised there were so many health systems involved. They were surprised there were so many community partners involved, and they were really excited about our resident engagement plan. So there are actually 55 Build Health communities in the country, and so this is the third cohort. So we're one of 18 in the third cohort. So it is a very prestigious national award.
So where does Build Health come from? Like, who funds it? Like, what is the mechanism? How is that created?
So Build Health is a national funding collaborative. So there are some major national funders like the Beaumont Foundation, Robert Wood Johnson Foundation, Kellogg Foundation, and Kresge Foundation. And then other communities or other states contribute more money. So there are other states like New Jersey and Texas that have kind of more money because their local funders put into that pot. So it's very well supported nationally, and it will bring a lot more opportunity for Omaha to get future funding. Others?
So ideally, what would you see coming out of this then? And has that person that you plan to hire been identified yet, or is that on the to-do list?
So we're currently hiring. We do have people in mind because we do operate in this neighborhood. So we have some people in mind. People have given us referrals for who they think would do a good job. What was the first part of your question? I'm sorry. That was the second part. Oh, what do we hope to get out of this? Thank you.
In this phase, planning phase, discovery phase.
Sure. So really, when we talk about planning and discovery phase, that really happens the whole time. You know, we obviously have some ideas of what people want to address by being in the community, and a lot of our partners are out in the community as well. But we really want to talk to residents in this neighborhood and say, what is it that you want to address? And that's something that will evolve, right? As things are accomplished and as things in society change or evolve, we might kind of move depending on what the residents want to do. And so what we're really trying to get out of this is that residents are driving this initiative. They are driving the health of their own neighborhood and their own community. And it's really focusing on that asset-based lens of the fact that residents in this neighborhood have a lot of strengths. How can we build on those strengths?
How do you foresee this impacting the city of Omaha at large? 68111 is the focus area, and it will be a testing ground for things. But how will this go to affect the metro?
Great question. So we're in 68111, but the target zone is really this neighborhood surrounding this community center. So we're hoping to have this community center be a neighborhood hub. But the idea is that we would be able to replicate this model in other neighborhoods that see high health disparities. So, and that's a big part of the Build Health Challenge as well, is the idea that you can replicate what you're doing so that you're making systems changes and you're making long-lasting change across a community, not just one area. So obviously the model can be used in multiple areas, but what people work on is different based on the neighborhood, because every resident or every neighborhood has things that they want to address that's different from others. So the idea is that we'd be able to replicate this model across the community.
At the end, do you hope to come out with like a plan that says, here's what everybody said, here's what we're gonna do?
Yes. So that will happen several times throughout, because the Self-Healing Communities model, it's first leadership expansion, and then you're narrowing into the action plans, then you're learning from those action plans, and then you're seeing the data from that, and it's a constant circle. So there'll be probably several rounds, because this is a 2.5-year grant, but we hope to do this for much longer than 2.5 years. And so that's something that will just happen continuously. But we are hoping to have an action plan, or the timeline shows that we will have an action plan, I believe, by the middle of next year.
What resources are you using to keep residents engaged throughout the process, as well as surrounding communities? How can we follow along in your process and see how this is developing?
So currently we have the community center here, and so that serves as a hub, and we do have a lot of community members in and out of the community center. We will, and it's kind of tricky because it really depends on what the residents want to do, and so we'll say, oh, we think we should have parties every month, or community dinners, or let's have harvest parties at our community garden, right? But again, that's from the perspective of me or other partners saying, oh yeah, that would be cool. But the reality is the residents know what's going to bring more people in, and they know what they actually want to do. So that's why it's so unique, is We are very used to, as human service agencies, saying, oh, this is what we're gonna do and we have this great plan. Now, we hope people come to it. This is different. So this is, well, what do you wanna do? All right, let's do that. Let's get more people involved. And really having that mentality of us as partners being on tap for residents instead of on top. And so it's a very different mentality that is really what makes this project really unique. Okay, well, thank you so much for being here, everybody, and helping us celebrate this award. Thank you to our partners. We're so incredibly grateful that you're here and that you're a part of this challenge with us. So, thank you.